name's Anthony Chapman. I did my undergraduate and my current research at the University of Aberdeen, and my background is in computing and mathematics, especially in evolutionary computing and multi-dimensional optimization. So the main research questions of my PhD are to link fetal and maternal data to non-communicable diseases in children and adults, like asthma, diabetes, and maybe obesity and things like that. So they want to find out what type of growth or characteristics of the baby or of the fetus as it grows will lead to which type of disease or asthma, or what the relationship is, or how we can detect it at an early age or not. So really we want to find out how we can detect it at an early age, yes. And one of the biggest problems with it is that there's a lot of missing data when you look at maternity data, because the study goes on for so long, and you know, the shift in people move from town to town, so they might go to a hospital in one city and then move and go to a hospital in another one. So a big part of that is how to predict what the data should look like when it's not there. That's another big part of the PhD. So the impact mainly will be the detection of diseases and disorders at an early age. And for example, it's already been linked that a certain type of growth in the Grampian and Aberdeen area is linked to a certain type of asthma. For example, if the baby grows at a non-constant rate, so if it grows really quickly and then slows down towards the end, it's more likely to have asthma. So we want to do similar things, but with lots of different types of diseases and disorders in a short amount of time. And where the computing part comes in is that they want to do it in the most efficient and correct way. So they want to make sure that all these patterns are not just gibberish. The best thing about this symposium has been to meet all the other people from around the UK and possibly working together in the future. After the PhD, there's the possibility of extending the research for a broader audience, so maybe finding out these relationships for maybe other diseases or other factors nationally or even internationally.